Are you getting all the vitamins and minerals your body needs? If you have chronic kidney disease or kidney failure, this information is crucial for you. Vitamins are essential for your body to function properly. They help you get energy from food, repair tissues, and keep you healthy overall. But did you know some vitamins and minerals are especially good for your kidneys? When it comes to kidney health, not all vitamins and supplements are created equal. For example, while you might think loading up on vitamin C is a good idea, too much can be harmful if you have kidney issues. The important thing is knowing which ones to focus on. Not to worry. By the end of this video, you'll know exactly which vitamins and supplements can help your kidneys function better. So, let's talk about each one and see how they can make a difference. But before we jump in, we promise you'll learn a lot. So make sure to like this video and subscribe to our channel for more health tips. 1. Vitamin D. Vitamin D isn't just for strong bones. It belongs to a group of fat-soluble steroids necessary for bone health, helping your body absorb and reabsorb calcium and phosphorus. When your kidneys aren't functioning well, they can't process vitamin D into its active form, leading to deficiencies that can cause all sorts of issues, from weak bones to heart problems. So, how does this vitamin help your kidneys? Firstly, it reduces inflammation and fibrosis, two processes that can lead to kidney damage. When inflammation and fibrosis take over, they can cause scarring and further harm to your kidneys. However, vitamin D, especially in its active form called calcitriol, can slow down this harmful process. It does this by inhibiting myofibroblasts, the cells responsible for fibrosis. As mentioned earlier, vitamin D also helps your kidneys manage calcium and phosphorus. It ensures that your body absorbs the right amounts of these minerals, preventing them from building up in your blood and causing even more damage. This is vital because when calcium and phosphorus levels are out of balance, it can lead to cardiovascular problems. Now, let's talk about inflammation. Chronic inflammation is particularly harmful to your kidneys. Vitamin D has some anti-inflammatory properties. It inhibits the prostaglandin pathway and pro-inflammatory cytokines, which are essentially the messengers that tell your body to increase inflammation. By keeping these in check, vitamin D helps reduce overall inflammation. If you have diabetes and chronic kidney disease, CKD, vitamin D can be a real lifesaver. Studies have shown that adding native vitamin D to your treatment regimen can reduce proteinuria, a condition where excess protein is found in your urine. This is beneficial because proteinuria is a marker of kidney damage, and reducing it can slow the progression of CKD. So, in a nutshell, vitamin D is a multitasker. 2. Folic acid. Folate is the natural form of vitamin B9 found in foods like leafy greens, legumes, and citrus fruits. On the other hand, folic acid is the synthetic version of this vitamin, often added to supplements and fortified foods. This vitamin is a superstar among the B vitamins, and here's why. All B vitamins play a role in converting food, especially carbohydrates, into glucose, which our bodies use to produce energy. Folic acid is water-soluble, meaning it dissolves in water and isn't stored in large amounts in the body. That's why it's important to get it regularly through your diet or supplements. At the cellular level, folic acid acts as an antioxidant in the mitochondria, the powerhouses of our cells. This means it helps protect our cells, including renal cells, from oxidative stress, keeping them healthy and functioning well. Plus, it's known to improve endothelial function, which is good news for cardiovascular health. But the benefits don't stop there. Folate, along with vitamins B6, pyridoxine, B12, and cobalamin, play a vital role in homocysteine metabolism. Homocysteine is an amino acid in the blood, and its levels need to be kept in check. A relative folate deficiency can lead to hyperhomocysteinemia, which is just a fancy way of saying too much homocysteine, a risk factor for heart disease. For those with kidney disease, this is particularly important. High homocysteine levels are common in kidney patients and can increase the risk of heart disease. Here's where folic acid supplements can make a difference. They help reduce homocysteine levels, potentially lowering the risk of heart complications. 3. Vitamin C. Vitamin C, also known as ascorbic acid, is more than just your go-to remedy for the common cold. Just like folic acid, it is a water-soluble vitamin. This vitamin is known for its antioxidant properties, which help protect our cells from damage. But when it comes to kidney health, vitamin C does even more. Research has shown that vitamin C can help reduce oxidative damage, inflammation, and kidney injury in various situations. This includes cases of nephrotoxic acute kidney injury, ischemia, and even injuries caused by muscle breakdown. In simpler terms, vitamin C can help prevent and repair damage to your kidneys. People undergoing hemodialysis often have a vitamin C deficiency. This happens because the vitamin gets lost during dialysis, and dietary restrictions can also limit intake. Low levels of vitamin C in patients with CKD are linked to increased oxidative stress, which can lead to more kidney damage and complications like LDL oxidation. So, how does vitamin C work its magic? Its antioxidative properties help reduce reactive oxygen species, ROS levels, which are harmful molecules that can damage your cells. By lowering ROS levels, vitamin C protects your kidneys from oxidative damage. It also supports the health of your blood vessels and maintains crucial enzymes that keep your kidneys functioning well. But, and this is important, too much vitamin C can be a bad thing, especially for people with kidney issues. High doses of vitamin C can lead to an increase in oxalic acid, which can build up in your body and cause problems, particularly for dialysis patients. So, it's all about finding the right balance. For most adults, the recommended daily intake of vitamin C is 75 milligrams for women and 90 milligrams for men. This amount is enough to enjoy the benefits without risking any complications. 4. Iron. Iron is a mineral that is important for making healthy red blood cells, which are the ones responsible for carrying oxygen from your lungs to every corner of your body. Imagine trying to go about your day without enough oxygen. You'd feel tired and drained. That's why iron is essential. It gives you the energy you need for daily activities. Your kidneys are crucial in this process by signaling your body to produce more red blood cells when needed. And iron is essential for making those cells healthy and robust. But here's the thing, about 15% of people with CKD are deficient in iron. This deficiency leads to anemia, which means you don't have enough red blood cells to carry adequate oxygen throughout your body. The result is that you're left feeling tired, weak, and out of breath. So, keeping your iron levels up is crucial for staying energized and healthy. Hemoglobin, the protein in red blood cells that carries oxygen, is made up of iron. So, if you're low on iron, your hemoglobin levels drop, and so does your oxygen supply. Normal hemoglobin levels are around 12 to 15 grams per deciliter for women and 13 to 17 grams per deciliter for men. People with kidney disease or kidney failure often have lower levels, which is why it's essential to monitor and manage your iron intake. Foods like red meat, beans, and green vegetables are great sources of iron. But if you're following a kidney-friendly diet, balancing your iron intake can be tricky. This is where a dietitian comes in. They can help you plan meals that include the right amount of iron and other essential minerals without compromising your kidney health. 5. Probiotics. You might not know this, but if you have CKD, your gut flora, the community of bacteria living in your intestines, can be quite different from someone without the disease. This might not sound like a big deal, but it affects your health in many ways, especially when it comes to your gastrointestinal health. Balancing the gut flora can do wonders, from improving digestion and boosting immunity to sorting out problems like constipation or diarrhea. For CKD patients, this balance can make life a lot more comfortable. Now, let's talk about probiotics. Probiotics are beneficial bacteria that, when taken in the right doses, survive the journey through your stomach and set up shop in your intestines. Once there, they can outcompete harmful bacteria, reduce inflammation, and give your immune system a nice boost. For people with CKD, especially those needing dialysis or a kidney transplant, probiotics can be a game changer. They can help manage uremia and lower harmful toxin levels in the blood. Now, probiotics from supplements are usually better than those from food for CKD patients. Why? Because many probiotic-rich foods can be high in potassium, phosphorus, sodium, and sugar, all things CKD patients need to watch out for. With supplements, you can control the dosage precisely, ensuring you get the right amount. Experts often recommend a blend of probiotics with at least 10 billion colony-forming units daily for best results. Recent studies have shown some impressive benefits. For example, in a mouse model of acute kidney injury, probiotic treatment increased beneficial plasma short-chain fatty acids and protected against kidney damage by reducing inflammation. Another study involving 21 peritoneal dialysis patients found that taking a probiotic capsule daily for 6 months significantly reduced levels of two major inflammatory markers, tumor necrosis factor alpha and interleukin-6. So, if you or someone you know has CKD, it might be worth talking to a healthcare professional about adding probiotics to the routine. Remember, vitamins aren't a magic fix for better kidney health. While supplements can fill in nutritional gaps if your diet falls short, be skeptical of any that claim to boost kidney function or cure CKD. Your kidney's needs are unique to your diet, health conditions, and overall well-being. It's always a good idea to see your healthcare provider before starting any supplements. They'll help you figure out what's best for you and how much you should take. Thanks for tuning in. If you found this video helpful, give us a thumbs up and share it with someone who might need it. See you in the next video.